Within hours, the longest government shutdown in history may be nearing an end. Thanks for joining us. I'm Casey Marler. Sarah Diamond on assignment for us tonight. The House will hold a vote that could reopen the government later this evening. News Channel 11's Brody Wilson spoke with Congressman Morgan Griffith on what the resolution looks like if passed. Brody, what did Congressman Griffith have to say?
Yeah, Casey, Congressman Morgan Griffith told me today that he's hopeful that the continued resolution will pass tonight, which would reopen the government after 42 days.
People in the 9th Congressional District have had enough suffering, and we certainly don't need the federal government adding to it.
Much of that suffering has centered around funding cuts to SNAP and other food assistance programs, and federal workers being laid off or working without pay. Two things that Congressman Griffith says can be fixed relatively quickly.
I would say if we vote on it tonight and it passes, that by the end of the week, a lot of things will be taken care of, and by Monday, we'll be back to normal.
Extending tax credits for the Affordable Care Act isn't likely to be as quick of a fix, though Griffith believes both sides are motivated to get something done to provide relief from the higher premiums by the December 31st deadline.
When people get bills from their insurance companies, I feel fairly confident we're going to get it fixed before you actually have to pay that money. Hang tight. We're going to get you some relief. It may not be 100% of what you want, but it's going to look pretty good. And like I said, even if we just got the 20% shadow enrollees, the ones that don't actually exist, out of the system and stop paying insurance executives for nothing, I could probably live with it for a bit of time as we figure out how to make the system work better.
One thing Griffith said he would be in favor of moving forward is a proposal that in future situations, if no resolution is found, they'll continue to fund the government at the current levels until an agreement can be reached.
You wouldn't have air traffic controllers, SNAP benefits, federally qualified health centers, telemedicine, all being impacted by shutdown.
We also reached out to Congresswoman Diana Harshbarger's office to ask about the ACA tax credits and received this statement saying, quote, Obamacare promised affordability, but premiums and deductibles have soared, leaving individuals and families paying more for less. Democrats have spent years masking those rising costs with short-term subsidies that send billions of taxpayer dollars to insurance companies. As the House prepares to end the Democrat shutdown, we can finally get to work on real solutions to lower premiums and make health care more affordable, end quote. The chamber is set to vote on the Senate-backed bill this evening, and you can follow the story over on our website, WJHL.com, where we'll bring you updates as soon as the vote takes place. Casey?